5. And these people have a doctor on call 24/7.
It's a very good value for us at our age.
Dr. Joe tells us why concierge care is becoming more popular. And the Fox 13 10 o'clock news is starting now. And more people are getting Dear John letters from their doctor. The notices say their doctor is leaving the practice and getting into the business of concierge medicine. Those letters are required by law, and they're going out faster than ever before. Just last year, in fact, about 1,000 docs across the country became private physicians. Industry groups believe there are 4,400 nationwide now, and these doctors practice for a price, a retainer. It can range from $400 to $5,000 a year to get to their services. It is a growing industry, to be sure, but so is the projected doctor shortage. Dr. Joe is going to show you now why some believe the fee is worth the price.
Thanks to a great investment made decades ago, Chuck Moore and his wife enjoy the beauty of their riverfront Bradenton home. But today, this former businessman is investing in something very different, his health.
It's a very good value.
For a monthly fee, Chuck and his wife are paying for personalized medical care.
Feels more like when I was younger, you know, as a kid, and we would go and our family had a relationship with the doctors.
Let's see how you're doing.
But that extra $450 a month also buys them specialized preventive services.
We go through a lot of extensive blood work and testing and looking at your arteries.
All right, I'm going to take a listen to your heart here.
Testing geared to cut the risk of stroke and heart disease.
Haven't had any chest pain or...
Cardiologist Dr. John Laurier is Chuck's full-time doctor. 2 years ago, Dr. Laurier had a busy practice.
It wasn't satisfying to me, and it wasn't satisfying enough to the patients.
Pretty good.
Doing pretty well?
Good.
He wanted more time to focus on wellness and keep more people out of the cath lab.
Prevention is actually more cost-effective than waiting until you're broken and then fix you. But for today, that means an upfront investment.
That upfront investment also allows you to bypass the receptionist.
Prevention Center, this is Debbie. May I help you?
Because Dr. Laurier's 300 concierge patients can call him directly on his cell phone.
It would be like being on call 24/7.
Tampa internist Dr. Karon LoCicero considered a personalized practice.
I would feel awkward sending a letter saying, if you want to stay with me, you would have to pay X number of dollars per year or find another doctor.
Paring down her busy practice would mean saying goodbye to thousands of patients she's treated for years.
It's the patients who might feel that they're left out because of their doctors moving to concierge medicine. That's what I'm concerned about.
Chuck says making the switch is working well for his entire family.
My dad just had to go in the emergency room last week. Within 30 minutes, Dr. Laurier was there.
He hopes investing in personalized care will pay off, buying him extra time to enjoy his waterfront home.
I'm on a really good track. All my indicators are going in the right direction, and I'm feeling good about that.
Now, the big question, is this concierge medicine a luxury reserved for the wealthy? Well, the American Academy of Private Physicians says no. They say one of their fastest growing patient bases are those with high deductible insurance plans as well as the uninsured, both hoping to stay well and stay out of the hospital.
This opens up a lot of questions about the future of medicine, I know, and for doctors, including you, Dr. Joe. What's the relationship to the shortage of doctors that we're hearing about?
They're saying that it does not impact the shortage. Again, they're looking at about 159,000 doctors being short of them about in the year 2025. So that's in part due to the number of seniors that will be around then, and also lots of younger medical residents are not choosing primary care, and that's another thing that's contributing to the shortage.
Can we say the system is just flat broken? Is that's what's pushing us to this point? Is it broken?
You know, I think, what I'm hearing a lot of is that there's not enough time to spend with patients. I guess it depends on the practice that you're in. Yeah. And certainly I think that what they're also saying is when you look at the statistics of these people that are in these concierge programs, there's less hospitalizations, less ER visits. But again, you're getting a group that's willing to pay to stay healthy. So, I'm not sure how these numbers are all going to shake out. But certainly, I believe in preventive medicine. This is preventive medicine. Everybody can take the steps to do preventive care for themselves. Everybody out there. Stop smoking, get your blood pressure under control, get your cholesterol under control. There's so many things that we can do, we have the power to do, and people just need to remember that they have that power.
I don't think any one of us wants to get sick. Prevention is more the cure here than the cure and the treatment here. Thank you very much, Dr. Joe. We'll see where it goes from here. We all have an investment in it. Thank you.
Stu.
Kelly.
All right, John. Well, Florida Senator Marco Rubio